Good morning, everyone. Thank you for joining us. This is a really important occasion for us, the mobile unit. If you get the chance to walk inside, it can hold up to 8,000 doses, which is incredible that this will be on the road visiting the rural parts of our state. And all of you know that we've got some pretty rural parts of our state, our tribal communities and so forth. They're basically distributing the Janssen vaccine, which is what I got. That's a single dose, but it's going to go a long way towards equity in making this available to everyone along the way. And we sincerely appreciate that. Today, I woke up, it was a much better day. It's the first day that everyone 16 and over can get vaccines. Everyone that is at least 16 years of age can get a vaccine. Time is now. Look online, go to the websites, make an appointment and get a vaccine, whichever one is available. That's what's going to get us out of this pandemic and get us through this entire situation. So we encourage everybody to get their vaccine, and this mobile unit is going to make that happen. And also, to the folks that are running the medical unit, I mean, they are going above and beyond. It is not the most luxurious of that you might see. They're going to be roughing it for a couple of weeks, and we appreciate that. But they're doing what needs to be done to take the vaccine out to the community and to help the people that desperately need it and are waiting for it. So with that, I want to thank you. It takes a whole group of people to make this happen, and you're seeing all of them here with us today, joining us in a special event. And I'd be happy to take some questions. And we've got the National Guard here, too, who I always want to acknowledge that are, I tell you, every time I turn to the National Guard, they're there for us. I mean, to do everything. And we sincerely thank you for what you're doing. If anybody has any questions, I'd be happy to take some.
What does this mean for you, saying Nevada is such a rural area and there's small pockets everywhere? Was this a concern in trying to how to deal with the rurals before this?
Yeah, it was definitely a concern how to deal with the rurals. We didn't have enough sites in some of the rurals. We didn't have vaccinators in some of the rurals. You saw that Esmeralda, they were having to go to all the other communities in order to get vaccines. So this, we're taking it out into the communities. You're going to see a lot more of that even in our urban communities, where we're going to be taking the vaccines into the neighborhoods. Everybody doesn't have the luxury of having a vehicle to transport them or living on a public transportation route. So it's more difficult for those folks. So we need to do more to get it out in the communities, and this is one step along that way. Yeah.
As of this morning, minorities are still about half as likely to have gotten the COVID vaccine. Is enough being done to make sure it's being distributed equitably across the state?
We are doing everything we possibly can across the state. A lot of that's left up to the local jurisdictions. I've spoken to local jurisdictions about getting out in the communities. That's what I'm talking about. We've talked about getting it into some of our senior centers, our local neighborhood centers, where they're more likely to be. If we have to take it into the neighborhoods in terms of a van going in there, we're going to do that. If we can do an accommodation with some of our church facilities to get it there where people can walk to get the vaccine, and we're going to do more to get that there. Everybody has to have access to the vaccine. We're going to do everything we can to make sure that happens. You're seeing it a lot in Las Vegas now, where we took it into the hotels to get it. Their workers, who are oftentimes minorities, are going to have the access to get it. So we're doing what we can to deliver the vaccine where the people are.
About how many vaccines per location, and how do you keep the vaccine cold?
With this mobile trailer?
This is Carissa from the state immunization team.
Thank you. So it's going to be about 250 per location that will be done. And there is a refrigerator in this unit that will hold up to 8,000 doses of the Janssen product. So that's what we're going with.
Carissa, how difficult is it to be able to get enough vaccine to do this? Because I'm sure you don't want to do multiple trips in the rurals.
We have enough vaccine with our state allotments right now to be able to handle all of the stops we're doing on the mobile unit.
How many stops are you guys planning on doing?
That's where I don't. Rodney? Apologies. How many stops are we doing total in the northern route?
In the northern route, we have 13 stops that are slated. In the northern route, we have 13 stops that are slated throughout the month, with the last stop being in West Windover, ending on May 1st.
How important is this to you, Governor, to have something like this, and the manpower to continue to do this? Because it's not a small feat to try to get some of these
It's
rural places?
it's incredibly important. As I've said all along, we are now closer to the end than we are to the beginning of this pandemic, but this is taking us steps closer to the end. I mean, you have to get needles in arms, and to have this type of equipment to be able to go out into these rural areas. And you folks know it. You can drive, like we joked inside, you can drive 60, 80, 100 miles and see nothing in some of these areas to get to the next location. So we're taking the vaccine out there, and but for the fact that having this trailer and this equipment, it wouldn't happen. So we're very, very grateful and thankful for it. I feel blessed that we have it, and we have two of them that are going to be working their way around the state. So we're excited.
What is Team Rubicon's role in this operation?
Team Rubicon. Huh?
Hi, so Team Rubicon is serving completely as support for the FEMA vaccinations. We will travel with them through the 13 stops as support, traffic control, any sort of back-end support that they need. We will not have direct contact with any of the patients or anyone getting the shots. We will be here to support any way we can.
Thanks for coming out, everyone.
And as you can see, everybody is playing a part in this, whether it's Team Rubicon, it's FEMA, it's the vaccinators. It takes a group of people and a tremendous amount of organization. We're thankful that we've got that to move forward, and hopeful that this will get these vaccines out there very, very quickly. And I'm going to take the opportunity one more time. It's a very special day here in Nevada. Anybody, one more time, anybody 16 years of age or older can make an appointment and go get their vaccine, to start the process to get your vaccine. It's extremely important. Take advantage of that now so we can continue our road to recovery. Thank you all very much.